you're welcome to DemiRx Care channel, where we talk about medications and how to use them properly. If you're new to our channel, make sure you hit the like and subscribe button down below. That way you can get alerts anytime we post our other educating videos, and also help support us here at DemiRx Care channel. So what is our medication for today? Our medication for today is called Methylprednisolone, which is also known as Medrol. So this medication is normally used in our patients who have asthma, or patients who have lung infection, patients who have an allergic reaction, as well as a skin disorder, patients who have Crohn's disease, also patients who have arthritis, most especially bone arthritis. Also patients with ulcerative colitis can also benefit from this medication, as well as gout and cancer. All right, so this medication is available as an oral tablet, as an intramuscular injection, or as an IV injection as well. So it usually comes in a 4 milligram dose, the oral tablet does. And it's also known as a Medrol dose pack. It literally has a dosing instruction on the pack. You have to take it a certain time of the day with food. That's usually how the dose pack comes in. So you want to make sure that you're sticking to that dosing instruction while you're on the medication in order to affect withdrawals. All right. So what are some side effects to look out for on this medication? So as you may have probably known, this medication is a steroid. So steroids tend to have nasty side effect profile. So usually there's some side effects to look out for. It's not much of a side effect issue if you're taking it just for a short-term period, but patients taking it for a long-term period, this side effect may be more prone in those patients. So what are side effects that you should look out for? First side effect, it can increase your blood pressure or blood glucose. So it could go either route. Like I said, it can increase the blood pressure. So if you are on blood pressure medications and you're taking a steroid such as Medrol, at the period of you having high blood pressure, if your high blood pressure is a bit elevated more than normal, know that this might be a side effect. Or if your blood glucose is a bit higher than normal, make sure that you're reaching out to your provider and making sure that this is a normal level that they still want you to keep taking the steroid on, and to make sure that you're tying that loose end, to make sure that you're not increasing your blood glucose and spewing out this blood sugar, or spewing out the sugar from your urine, and you could have been taking another medication that could have helped as much as the steroid without that side effect. All right, so another common side effect is stomach upset. So usually they would advise patients to take this medication with food. That way it can reduce that side effects, the stomach side effect, upset side effect of the medication. Another common side effect is mood changes. So patients have noticed that their mood have changed from it could either be super happy or like super moody. So just make sure that you're on the lookout for that. If you don't like the side effect, like I said, reach out to your provider and find out if there are other substitutes that you can switch the medication out for. And like I said, this might not happen since you're only taking the medication for a short-term period. All right, another common side effect of this medication is fluid retention. So the medication can cause weight gain. So just be on the lookout for that. That might just be a weight gain from your body holding on to more fluids than it's supposed to. Also, it can increase your appetite. So this is a big one that I've heard from most of my patients. They're like, Abby, I've been eating like crazy. Is it like, what is causing that? And I'm like, yes, you're on steroids. So quite expected. So just make sure if you're seeing those side effects, if it's not favorable, reach out to your provider and see if there are other options. If it's just for a short period of time, again, I am not too worried about that side effect. Usually patients will normally take this medication for about 6 days and then stop it once whatever the condition they're treating subsides or reduces. All right, so this medication, if taken for a long-term period, can also cause changes in vision. It can cause skin changes as well as increase the risk for infection as well. And like I said, this is also dependent on how long you're taking the medication. So what are some other things to look out for while you're on this medication? So you want to make sure that you're avoiding live vaccine if you're taking the medication for a long period of time. So make sure that you're reaching out to your provider and letting them know, hey, I'm on a long-term steroid medication. Do you think this is a vaccine that's appropriate for me? That way they can kind of note that, most especially if you're getting the vaccine in another health clinic or another pharmacy compared to the regular pharmacy you would get your medications in. So, like I said, this medication can kind of decrease how fast your wound heals if you're taking the medication, so be on the lookout for that. Also, like I said, you want to make sure you're taking it with food or milk or some type of meal to kind of help reduce that stomach upset side effect that can occur. Also, with this medication, you don't want to stop it abruptly, which is stopping the medication all of a sudden. You do not want to do that because this can create a withdrawal effect if you do stop the medication without gradually reducing the dose. So usually with the dose pack, you start with a higher dose in a certain period. So sometimes patients will have to take 2 in the morning, 2 in the afternoon, 2 at night, and they just kind of reduce it. So 6 on, let's say, a Monday, Tuesday you take 5, 4, 3, 2, 1. That's usually how they kind of dose that medication to help with those side effects. And that is just an example of how the dose back comes in. It might not be exactly in the number system that I just said. All right, so if you miss a dose and it's closer to the next dose when you remember to take it, please just wait until the next dose and don't double this medication. You don't want to double your dose. That way you're not getting increased side effect. And usually with my patients taking the dose back, I normally advise them that they take their last pill of the day not closer to the bedtime, because this medication may keep you up, so you don't want to take the medication closer to bedtime. So let's say you go to bed at 8 and your evening dose should probably be taken around about 5 o'clock, giving it like about 3 hours period in between. That way you're not taking it immediately before going to bed. All right, I hope this counseling points were able to help you in terms of what to look out for when taking Medrol. If you do have any questions, make sure you reach out to our pharmacist on DamiaRxCare.com if you have any question regarding this medication. Also, make sure you hit the like and subscribe button down below. That way you're able to get alerts anytime we post our other educating videos. Thank you and stay blessed.